Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, and joined by Steven. Welcome in, brother.
Hi.
We're back.
Yes. I'm just like, I'm just.
You've changed clothes. We actually just stopped recording our episode about cats, and now we're recording about dogs. But Steven had a wardrobe change.
The
Steven,
rest of you did not. So
tell
again,
us.
if you only see this if you're on YouTube. So go. We'll just make the shameless plug. Like, subscribe, share this podcast with people who would gain from it. If you already like it, share it with someone you know, and don't forget to check us out on YouTube.
All right, Steven, stand up and walk to the camera and show them your shirt
Just
logo.
slide over.
Yeah, it makes too much noise. So Steven's going over to the camera. He's showing off his wardrobe. It is a T-shirt with our annual Walk My Dog. That's our first T-shirt from 2020 is when we started the Walk My Dog program. So this year, it's going on now. Registration is open right now. You can go to familypethealth.com/Walk My Dog and sign up. You walk your dog, you log your miles, you win free prizes. It's a great deal. It costs you nothing.
It's free.
It's free, free. And there's lots of benefits to this. You're bonding with your dog. You're winning prizes. You're spreading some joy all over the neighborhood as kids come out to see your dog. That may not be true or not. I don't know. But this is there's also each week there is a social media challenge. We're partnered with 9 local businesses. And you can go back and listen to an episode a couple weeks ago where we talked with Haley about the Walk My Dog Challenge. And you can learn about those local businesses. Each week, a different local business is sponsoring, and they are providing a prize for the social media challenge. So along your walk, you take a picture that completes the challenge. So it could be things like stopping to take a drink, or smelling the flowers, or things like that. So it's a great opportunity for you and your family to get out and do some things with your dog and win prizes. So enough about the Walk My Dog Challenge.
But we're still going to talk about dogs today.
We
have a repeat guest.
Yay!
Crystal.
Crystal's back.
Crystal is here to talk to us about the life stages of dogs. And no matter what life stage your dog is in, the Walk My Dog Challenge is appropriate for you. But we may talk a little bit about some of the differences between a puppy versus a senior dog in the Walk My Dog Challenge. So without further ado, we are back with Crystal Stanfield, a licensed veterinary medical technician here at Family Pet Health. She's been with us for almost a year now. And this is your second time on the Family Pet Podcast.
I'm an old pro now.
Actually, as I'm thinking through this episode this is a second recording, but it will actually run before the cat episode. Sorry.
No, it won't. Not now. It won't. So I've already spent 3 minutes and 7 seconds talking about how last week we talked about cats. So we may have to look into that. We'll see who wins.
We'll see. If we want this episode to run before the Walk My Dog Challenge.
Oh, me. Okay. Well, this is...
it's all good. It's Crystal.
It's Crystal. She's
We
here.
love Crystal.
Crystal, talk to us about the different basic life stages of a dog.
So your basic life stages are going to be your puppy, your adult, and then your senior.
All right. And what do we consider a puppy?
So puppy is going to be birth up until, kind of depends on the breed, but around 12 to 18 months.
Okay.
All right. And then we'll just run adult would be 12 or 18 months until what age?
Until about 7.
About 7. Okay. And then senior.
7 to whatever age.
All right. That's pretty straightforward.
Yeah.
Is there a difference? We talked a little bit about this, and this is going. We're doing the cats first, okay? We're doing the cats first. I don't care when this episode. We talked in the cat episode that we don't see as much variation on generally speaking with cats, but with dogs it's different, right?
It is a little bit. Yes.
So the age the ages you just gave us, we had a 12 to 18 month range for puppies.
Yes.
When it comes to seniors, you're like from 7 until. But the AKC just released the #1 dog breed again. This in 2023 was the French Bulldog, but their life expectancy is only around 7 or 8 years, right?
Yeah. I think depending on the breed, so larger breed dogs are definitely going to have a shorter lifespan. So a lot of your Great Danes, they're usually going to have an 8 to 10 year lifespan. French Bulldogs probably about the same. There's a lot of genetic things that can go on with French Bulldogs. A lot of bone, spine issues. We see that quite commonly. They have a little bit more of a shorter nose, and a lot of times their nares are very small. Their nose holes are very small.
Oh yeah,
So
we
that
do a
makes
lot
it
of
harder for them to
enlargement
breathe.
surgeries on
Yes,
our
we
dogs.
do. We do. So that can definitely affect their.
So there may be some breed specific nuances when we talk about life
Right.
stages, but we're going to generally speak, we're going to today use the 12 to 18 months
Mhm.
and less for puppies, less than 7 years for adults, and greater than 7 years for seniors for today.
Correct.
But just know that your dog breed may be a little different. Talk to your veterinarian, and the earlier the better,
Mhm.
to set up some of these parameters for your specific dog.
Yeah, the veterinarian will know, hey, you've got a Mastiff, that
Mhm.
lifespan is this, and this is the steps, or these are the markers in their life cycle.
Mhm.
Do we have do we break these down any more, puppy, adult, seniors, into like subcategories?
So puppies mainly. Puppies have different periods of time based on their age. So with puppies, you're going to have the neonate. You're going to go through a transitional period. You'll have your socialization period,
Mm.
and then typically the testing period, which I feel like is where my puppy is right now. So they're going to be testing those boundaries.
Testing your patience.
Absolutely. And then adolescence, which is, towards the end of the puppy stage.
Let's talk about your puppy.
Yes.
You, your family added a puppy recently.
We did.
Christmas, right?
Yes.
Yeah.
I've never had a dog as an adult. So
This
this
is your-
is
this-
yeah. This
okay.
is totally new for me.
All
So
right. How's it been so far?
It has been an experience.
So, what breed of dog did you all get?
We have a Moyen poodle.
A Moyen.
Yes.
I thought it was Moen. Moyen.
It might
Okay.
be. I might be pronouncing
No,
it
I don't
wrong.
know. I just assumed. I have no idea. We'll go with Moyen. I like
Okay.
that. It sounds better. Moyen. So what does it look like? What size? Like how big is it? Things like that.
So he should be around 25 pounds ish, fully grown. He's kind of in between. Moyen, or however you pronounce it, is.
We'll go with Moyen. You're right. I'm right.
It stands for a fourth, so it's French for 1/4. So it's in
Okay.
between a mini and then a standard.
If it's French, it's definitely Moyen. Moyen.
Who knows?
Moyen.
I don't know.
I like it. Okay. So it's
So it's like a mid-size.
yeah,
Yeah.
a good family size
Right.
dog. Okay.
Yeah.
And I remember you came and talked to me before you brought him home, and you asked if you could bring him to work. And I
Yes.
said, well, I don't know. Like, we've never really let people do this before. And I didn't want to
But we've
open
never
up.
had anybody.
We've never
ask,
had anybody,
so-
nobody with a puppy,
Yeah.
and except our own. And we had Waggett Better was
Right.
working with us at the time. So
Yeah.
at any rate, you asked, and I said, well, as long as it doesn't become a distraction while you're doing house training, that's
Mhm.
fine. And I remember on your very first day of having him here, you had this look on your face, and I'm like, it's okay. It's the first day, because he was not happy.
He was barking, yes, and I was like, "This is going to be a disaster."
He was stressed, yeah.
Yeah.
But now he does great. I
Oh, he
forget
does
he's
great.
even here. He's
Yeah.
still coming to work regularly for
Yes.
the training. And
I think we're getting to the end of that, hopefully, so
Okay.
it's starting to catch on.
we'll kind of miss him.
Potty
He's
training.
been a
I
good.
know.
He's been a good. You have a stressful day. You go like, I'm gonna go walk the
Yeah.
dog.
Everybody goes in there like, "Where's your dog?" And I'm like, "I left him with my husband today."
We're all like, boo.
Yeah.
so it has been good for us to have a little dog. We just anytime I give a tour, I just let him outside,
Yeah.
and he gets to run around. He does a great job. So what are some things that our puppy owners might see or observe that they need to be mindful of?
So with puppies, one of the biggest things is just making sure that they are not eating things that they should not be. Mine especially likes to pick up every single thing he sees to put in his mouth, and so that could lead to a foreign body. So you have to be really careful about those types of things. Dietary indiscretions, so they can pick up mulch
Right.
or toxins from plants, things like that. So you have to be pretty careful because they're very curious and they want to know what everything tastes like, smells like,
Mm-hmm.
and so you just have to be really careful with that.
I don't know if you know the story or not, but the dog in our logo, in the Family Pet Health logo, is named Tadpole. That was my German Shorthair Pointer puppy. She's also on the Walk My Dog. We're German Shorthair. It's me. I'm like, hey, if
You're
I'm
the
paying
problem, it's
if
you.
I'm paying for this logo, it's going to be my dog. So I named her Tadpole because she was the runt of her litter,
Mhm.
and she always was small, and she never grew. I named her Tadpole thinking that she would grow into a bigger dog. Dr. Harris who I worked for at the time, he ended up, we took some x-rays to figure out what was going on, and her whole entire stomach was full of what we thought was a wing of a bird.
Oh my goodness.
But when it was, the x-ray images were looking at it so that it looked like bones, wing bones. But if you rotated the dog over, then you realized it was linoleum pieces
Oh my goodness.
that were just about the size of a silver dollar, maybe a little bit bigger, and they were stacked on top of each other, and there was no room for food and nutritional uptake, and that's why she was so small. But she had eaten. I called the breeder, and he's like, "Oh yeah, they tore off. He had put linoleum on the side of the doghouse, and she had chewed it all off and eaten it.
Yeah.
And that was a foreign body
They'll do
surgery.
it.
They
And
And I'm
stunted,
like, how do they
stunted her
even
growth.
swallow that
I know,
stuff?
like it seems
It's
so
amazing what they can swallow.
so painful. It's like jagged sharps. I know you were going to say something about
My question to you, when you
Mhm.
talk about puppies and
Mhm.
eating and emergency surgery type treatment, do you have pet insurance on?
I do not yet. I know. I can't decide which one I want to go with.
Oh well, we have a whole podcast episode.
Episodes about that. All right. So, but I would encourage
Stephen, look at the camera and tell the people on camera.
I would encourage you, if you are listening to this, and especially if you've got a puppy, invest in pet insurance. There are multitude.
At least get through the puppy stage.
Right.
Oh yeah.
And then you can cancel it if you feel like you don't want to use it. But my goodness.
But it is so, the value of having it and just feeling I don't have to worry. Like I've got pet insurance on Maverick, and I just know that if he ever blows out his knee,
Mm-hmm.
okay,
Our
I'm okay.
Our
Yeah.
sister got a poodle
Uh-oh.
puppy, and it was on the bed, and it knew it wasn't supposed to be on the bed.
Jump
So
off.
she walked into
No.
the room, and
Uh-huh.
it tried to scurry off the bed and got its legs stuck between the mattress and the bed
Ouch.
frame and broke its knee.
Femur,
Broke the
Broke the-
femur.
femoral head.
My mom called and she goes, $40,000 for surgery. I was like, what are you talking about? She goes, I was like, Mom, I think that's a misunderstanding.
extra zero.
There's an extra zero. But it was a $4,000
Yeah.
surgery.
But they
It can be
had
really expensive.
they'd gotten pet insurance.
Oh,
they
I bet
didn't get it
that-
on their first visit, and I was like,
You better do
Joey,
this.
you've got to get it. So they got it on their second visit,
Mhm.
and they went through, applied, and there's a
Waiting
brief
period, yeah.
waiting period of a day or two, whatever. The
Or a
puppy
week.
broke the leg literally the next
Oh,
day
they're
after
lucky.
their insurance was fully in,
Mhm.
and we could say no, this happened. This
Yeah.
was a traumatic event that happened literally the day after they
So-
got their insurance.
Yeah.
So anyway, Crystal, we wanted you to
Well, I encourage
educate
you.
our curious pet parents on the podcast, but we're educating you today.
Well,
We need to
thank
get you
you.
signed up
Yeah, I
today
think-
before.
have
Okay,
to.
so be aware of your puppy at the stage of eating everything,
Mhm.
proper diet for
Yes.
their breed. What about vaccinations? We talked about that with kittens. Vaccinations?
Yes, definitely vaccinations. Puppies can get some really gnarly diseases if they are not vaccinated, parvo being one of them.
Okay.
And parvo can be deadly. A lot of those puppies don't survive. A lot of them do. It just depends on, what strain of parvo they get and how sick they get.
Rabies is by
Definitely
law.
rabies. Absolutely.
Okay. What are
Yes.
the other core vaccines that we have?
Bordetella, which is for kennel cough.
Now, is that a required one or a recommended?
I think it's a lot of grooming places and boarding places will require that because
Mhm.
it is so spreadable.
Right.
So they do require, most places require that, and
Respiratory.
we do recommend it
And then
for certain.
the secondary, which is less required, but
Mhm.
still is very often required by breeders and groomers, is the influenza.
Absolutely. Yeah.
So-
We saw a big influx of influenza a couple years ago, I believe. And so we were seeing a lot of cases of that. And dogs were getting pretty sick. I mean, they were getting pneumonia.
Mhm.
And so we are seeing some of that. I don't think we've seen any flu cases here, but I know for a little bit, a couple years ago, I
Right.
think
October of
there were quite
2022.
quite a few.
So, parvo, rabies, bordetella, flu. What are the other core vaccines?
Leptospirosis.
Okay. And what is lepto?
So lepto is a bacterial infection they can get from the environment. It is transmitted through wildlife urine, so infected urine.
And we used to say that was not a core vaccine, but we have at Family Pet Health have
Yeah.
switched that to a core vaccine. Why did we make that change?
It is something that humans can get as well. So it's a zoonotic disease.
And it's reportable, right?
yes.
Yep.
Yes.
So So big deal there. Plus, as you may say, well, I live in a neighborhood. Well, your neighborhood last year was a farm. And
Mhm.
so, and we're also seeing a lot of wildlife moving into the city. Here at
Right.
Family Pet Health, we
Mhm.
every night have a herd of deer that walk right across our parking lot every night.
Maverick and I on our walk a couple of years ago in
Mhm.
the neighborhood,
Mm-hmm.
we had 3 deer
Mhm.
that followed us.
So
for
they're
little bit.
moving, we're moving into their areas, they're moving into our neighborhood. So the interactions and contact between wildlife and your pets is increasing, especially in our area. So,
Mhm.
distemper is part of that.
Yes.
It's a combo
Distemper,
vaccine.
Yeah.
Yep.
So, and there's some upper respiratory things in that too, like parainfluenza, that kind
Mhm.
of thing that's
Okay.
in with that.
What are the extra things people could decide? I know we have some hunting families that
Mhm.
with hunting dogs that do extra vaccines. What are some of the
So,
extra things?
Lyme vaccine is one of the extra that you can do. Since we are seeing more Lyme now than we used to. You only saw it kind of in the northern states up around there, but we are seeing some here now. So a lot of people are choosing to have the Lyme vaccine done as well because it is a tick-borne disease.
And I vaccinate Maverick against Lyme, and we don't. I think we don't go on hikes. We don't go on these trips into the woods, but we walk on the greenway.
Mm-hmm.
They can
And
literally, the ticks will fall out of the tree onto
They
you.
will.
right,
You
so
go under a cedar tree, the ticks are
And
like
I feel
hanging
like
out,
ticks,
waiting.
I think, are heat-seeking. So
Yep.
anything that emits heat,
They sit on the edge of
They
and they
do.
put their little legs out and wait for you to walk by, and they grab
they
you.
do.
So again, I live in the middle of Murfreesboro, but we are exposed to Lyme just because we go to the dog park and another dog may drop a tick, or we go on the greenway and he's off to the side into the tall grass.
Mhm.
All
So
the time.
it is a risk. What else for puppies? So vaccinations, feeding, anything else?
So socialization is a really important
yeah.
thing for
Okay.
puppies. Exposing them to different sights and sounds and other pets can be really important for their growth.
One of the things or conflicts is that we tell people in past episodes that you don't want to take your puppy out and meet a whole bunch of strange dogs until they're fully
Mhm.
vaccinated. But the puppy socialization period is really important to happen
Mhm.
while they're getting their vaccine. So how do we
Right.
balance those two things?
So you want to make sure, I think in most cases, that your puppy has at least 1 to 2 vaccines before you start introducing them to other pets. There are some socialization things that you can do before then. So introducing them to other people and, showing them how to behave around other people, which is what I'm working with mine. But also, if you know someone that has a dog that has been well vaccinated, that's already started on their vaccine plan, even if it's a younger dog, those might be a little bit safer
And
than.
you mentioned, Michael, that Wag It Better has a puppy socialization group, a puppy daycare,
Right.
but they are very stringent on the puppy must have been vaccinated of these things at these point, but those puppies and only those
Right.
dogs are allowed
Yeah.
into this group to play, to socialize. So
And
it's
they have a
very
private
controlled.
room, yeah,
Right.
that general public's dogs aren't going into.
And they clean extensively.
Mhm.
So there are options, and our listeners can look into those
Absolutely.
puppy socialization groups.
If you don't have a reputable dog trainer available with a class like that, you can also just find in your community other people that have a similarly aged puppy
Mhm.
and just talk to them about their
I'll show you my vaccine records
yeah.
if you'll show me
It's
yours.
an online
Right.
dating for your
Yeah.
puppies to hang out together. But you do not go to the dog park.
Do
Right.
not.
Yeah.
And
So
be
like
careful.
what I did here is I had, one of our other technicians, Haley, has a little puppy, knew it had been vaccinated. So we allowed them to play together and
Mhm.
kind of socialize with each other while they were here.
Right.
So that they could have safe play.
Correct.
Together.
Safe play. I like that.
Yeah.
Design and find safe play.
As we move into our adult dogs,
Mhm.
do any of the vaccines or prevention? Oh, we didn't talk about prevention, but
Right.
prevention. We'll
Mhm.
talk about it now, maybe. Do any of those things change we're instead of doing a series for puppies, we're moving into
Right.
annual vaccines. Are
Mhm.
the vaccines the same?
They're pretty much the same. So you're still going to do your distemper parvo vaccine. Some of those, once they've been vaccinated, you could do those every 3 years.
Okay.
But we try to alternate between the distemper and rabies, doing those every 3 years. Rabies is the same. Lepto, you're just still going to do your annual, just one vaccine, flu and then Lyme as well.
And if people didn't catch our episode about prevention, in the cat episode,
Mhm.
tell us about prevention for dogs. Is it the same?
It's pretty similar.
Okay.
So dogs do need to be on a heartworm, flea, and tick prevention. There are products out there that are an all-in-one. So, like
Mhm.
for instance, we carry Simparica Trio here, and that includes everything you need. And you can start them on that as a puppy.
And that's a once a month
It
pill.
is a once-a-month
Okay.
pill.
But if someone is like me
Mhm.
For me.
and is very forgetful or busy
Yes.
life, the schedules get changed
Mhm.
regularly. But flea and tick is important, but I can start that or stop that,
Mhm.
right, as I see a problem.
Right.
But when it comes to heartworms,
Mhm.
I need to have constant coverage. Don't need to miss anything.
Right.
What's our option for our pet parents out there?
ProHeart is our best option. So that is an injection that you can give. And here we do our ProHeart 12. So it's a yearly injection. So basically you give one injection and you're good for the year.
I like that.
Yeah.
Make it
That's-
easy.
That's what I do with Maverick. I do because I forgot to give him. It's not that I was like, oh, I'll do it or I don't. I just forgot for March to give him his flea and tick prevention.
Right. Life gets busy. You just forget.
But I know for a fact, I know 100% he is protected against heartworm because I did it one time at the vet, and then I don't. It's not on me to remember.
Mhm.
Yeah, you'll get a reminder from your pet desk app.
Once
Yeah.
a year.
The flea and tick.
Mhm.
So heartworm's fatal, or it can be.
Yes.
Like, and it's in Tennessee in our area, it's 80% chance that if your pet's not on heartworm prevention, is
Mhm.
going to contract heartworm disease.
Right.
What about fleas and ticks? Is it fatal? Are there any fatal diseases that we're trying to prevent?
There aren't so much fatal diseases as far as ticks are concerned, but there are tick diseases that can cause some sickness in our pets. And so it's not like the cytox in cats, but it can, they can get Lyme and they can get Ehrlichia and things like that, which can cause some issues with our patients.
Just protect your pet.
Yeah.
I don't want my dog to get sick
Right.
on something that I can prevent.
Right.
Right.
I can prevent this. I
For
can
sure.
prevent it with one
Mhm.
pill a month. Prevent it.
So we're going to prevent diseases and parasites through monthly prevention or
Mhm.
yearly vaccines.
Mhm.
Are there any other concerns when our dogs are in this adult stage that we need to be concentrating on? Maybe the top three. Give us a top three.
So I would say dental care is
Okay.
a big one. Yearly blood work, and then your diet and exercise are really important as well.
Okay. And any big points you want to talk about those things with? Let's talk about dental care. Can we
Yeah.
just lift up the gum and look at the teeth and say, oh, it looks good?
It's a little bit harder than that. So
Okay.
sometimes we will also look at the gum. Is there a lot of gingivitis? So is it very red near the gum line? Do they easily bleed when you touch them? So that kind of will tell us the stage of gingivitis that we're in. So even if you don't have a lot of tartar on the teeth, you can still have a lot of gingivitis and still
Okay.
need some attention with the dental cleaning.
And then you were talking about it, can you just look?
Mhm.
Maverick
That's
was
the
in
first, yeah.
Maverick was in for his dental, and I
Mhm.
took pictures and videos and watched Dr. Robinson do the inspection of his teeth. You're talking dental X-rays.
Yes.
Then she takes probes to see how far up
Mhm.
it can along the
This
tooth
was
line.
after he was sedated.
Yes.
Oh,
yeah.
yeah.
To be asleep for that. Yes.
Yeah,
yes.
There's no way.
Oh, no.
You could have stuck one of those little
No.
scrapey, pointy.
No.
No way.
Well, I wasn't going to. That's for sure.
And then they it's just the number of tests that they're doing. That
It's
dog's
very
gotta-
thorough.
and
Yes.
that dog has to be sedated to
Yes.
be able
So
to
we're
do that.
looking for big problems like a cracked tooth,
Absolutely.
a worn down
Bone
teeth,
loss.
bone loss,
Mhm.
gingivitis.
Yes.
That's about as much as you can do with just the naked eye.
Mhm.
The rest of it, the dog has to be sedated, and we're talking further
Yeah,
diagnostics.
yeah.
Okay.
So we take x-rays to determine if there's bone loss, but we can also see if there are perforations or if there, some teeth can be diseased so much that they're dead. So there's a lot of things that can go on in the mouth.
I think I mentioned this. Our family went on our first hike of the year. We went out and we found a skeleton of a coyote.
Oh, wow.
And of course, Amy and Dr. Shirley's like picking up and looking at the teeth, like, oh, it's got a lot of bone loss here. And I'd really like to take this into the office and show you. I was like, well, let's take it. The kids were like, no, leave it here for later. So it was very interesting that even our coyotes out there need dental care.
Absolutely.
Which is not much different than
on a hike. You take only pictures, you leave only footprint.
That's right.
There you go.
Some people don't realize that dental health can affect their overall health. It's not.
It did work out well for that coyote,
right? So it's not only just loose teeth and broken teeth can cause pain in the mouth, which can decrease their appetite and eating. But also just the bacteria being in the mouth can have effect on their heart, their liver, their kidneys. So it's pretty much every organ can be affected by that.
Yeah, Dr. Robinson was explaining the connection in a dog's mouth. The teeth are actually connected into the bloodstream differently than in a human. Yeah. So the bacteria is literally just it's a straight shot into the bloodstream.
Yeah.
So it's a mess. What else for adult dogs?
So diet is very important. We want to watch their weight. So if you have a very, like Steven's dog, if you have a very active dog, you may not have to worry about that so much. They kind of regulate themselves as far as their body condition score.
He's a BCS5.
That's right. But there are some dogs that put on weight that are less active. They're more sedentary. And so they do pack on the pounds a little bit more. That can have effect on internal organs as well, just all of that weight. There's, fat around the organs and that kind of thing, but also just their bone structure, their joints, that can really affect it as well.
We mentioned about blood work with cats. Is blood work important with dogs?
It is. So every year we want to do a heartworm test on dogs. We want to make sure that they're still heartworm negative, especially if you're on an oral prevention that you're giving monthly. If you miss a dose, we want to make sure that they weren't exposed during that time that they missed. So we definitely recommend checking heartworm tests. And then also just tests to check liver, kidneys, thyroid function, because those things can start changing as they age.
As we move in and transition into our senior dogs, do we have any major shifts?
So there can be. So some dogs can start having some kidney issues. And again, like cats, we have some early renal testing that we can do to check kidney function. But you can also see changes in thyroid. You can see changes in liver, especially if, early on in their life, if they've been on chronic medications, we can see changes in their liver just from that. But we also see, like I said, thyroid. You can also get some disease processes like Cushing's or diabetes, and we will check for a lot of those things on blood work.
All right. When I think of older, I'm not feeling it yet. But I know that maybe in my future I might have joint or arthritis issues. Is that something for our dogs to be mindful of?
And I think, larger breed dogs are probably going to be feeling it a little bit quicker than smaller breed dogs, but you can still see some changes there. They're not wanting to jump on things like, oh, this dog jumped on the couch all the time and now he's not wanting to do that. Sometimes you'll notice it when they're from a seated position trying to stand up. It takes them a little longer to get up or a little longer to lay down. Those are some early indicators that they're having some pain. And we can see that change quite rapidly, even in some of our senior dogs. So getting them on joint protectants, there are foods out there that have some omega-3 fatty acids, some glucosamines in there. So those are really important. And then we also have Librela. So for dogs that are in that stage where they're starting to feel a little bit of pain with their joints, we can start them on Librela, which is also the anti-nerve growth factor.
Monoclonal
antibody. And that can also help with pain. And it kind of heads off a lot of those issues with mobility.
I feel like we could probably do 3 episodes, one episode about each life stage, but this is a good general approach, or the 30,000 foot view of the different life stages of your dog. Just the main thing, the big takeaway here is to be aware that your puppy has different health concerns than a senior dog, and the adult dog in the middle. You're monitoring things to make sure that they can get from the puppy stage to the senior stage. So work with your veterinarian. Just ask about these things, formulate that partnership, and follow their advice and work together as a partner. Crystal, thank you for joining us. Before we let you go, is there anything that we should have asked you that we didn't? We get everything covered. Again,
I think we got everything.
Big view. Yeah.
Big view covered.
So that means there's only one thing left to do before we end this episode. And that is for you to impart some knowledge to our curious pet parents out there. Help them win trivia night, or at least impress their friends and family with today's fun fact. So what do you have for us today?
Well, since we're talking about dogs, I'll talk about dogs. Did you know that dogs' smell is about 1,000 times stronger than a human?
I believe it. But that also brings up the question, why do they eat their own poop?
Because they have fewer taste buds. We've had this as a fun fact, but they have significantly fewer taste buds.
Yeah.
But there's nothing about poop that makes me.
But to them, it smells like their food. So it's very similar to what their food smells like. Okay. So a lot of dogs which is gross, but it happens.
Yes.
Their hearing is also way better because my dogs can be hidden in our house, but as soon as I open up a cheese, the Cabot cheese, to slice a few, I turn around and there's 3 dogs looking at me, like staring, like, "Hey man, you gonna drop some of that for us?
Drop some cheese."
Yeah.
Right. Crystal, thank you so much for joining this episode of the Family Pet Podcast. We hope all of you listeners out there enjoyed this episode and then learned a little something new. Please like and share this episode with your friends and family, including podcast. Go to the YouTube channel, Family Pet Health. Just look for the Family Pet Podcast on YouTube and hit subscribe. I'm selfishly trying to get to 100 followers so we can get our own custom URL. So, but
help us out.
And then last but not least, a reminder: if you've made it this far, you need to go and register for the Walk My Dog Challenge. It's going on through May and June is when it starts. You can join anytime, but go ahead and register now. Walk your dog, log your miles, win free prizes. And until next time, stay curious.